All right, good afternoon and welcome to Arkansas Children's Live Remote. We are chatting today with Dr. McVay at Arkansas Children's Northwest in Springdale, Arkansas. And we are talking today about pediatric surgery. If your child has to have surgery, as a parent, you probably have concerns and you have questions, but rest assured that the pediatric experts at Arkansas Children's and Arkansas Children's Northwest are trained to care for your child. We call it right-size care, but it basically just means that they realize that children are not just miniature adults, that they are each unique and every patient is special. And so they're treated that way. So Dr. McVay, welcome and thank you for your time.
Thank you so much. Delighted to participate.
So first, we just like to kind of start with a little personal background as far as tell us a little bit about yourself and how you chose pediatric surgery.
Absolutely. I was born in Arkansas. I grew up in Fort Smith, so right here next door to where I work at ACNW in Springdale. Did my medical training in Little Rock from medical school through residency and then fellowship in pediatric surgery. Pediatric surgery actually picked me as a specialty. I fell in love with it from day one, early on in my clinical years in medical school, and have happily pursued it through the rest of my career. I spent a little bit of time in San Antonio, Texas, working there before deciding to come back and help get ACNW up and running and expand the breadth of pediatric surgical access to care in Arkansas.
We are so glad you are in Northwest Arkansas and taking care of children there. If a child has to have surgery, a parent might just be rushed into a decision as far as who does the surgery and why. But why is it important that a child have access to a pediatric surgeon?
So that's a great question, and it's not an infrequent one. I think even sometimes my friends and family don't really understand what I do as far as being a pediatric surgeon. And the thing that we can offer to children is we have specialized training in the pediatric surgical diseases that are either entirely different than surgical diseases adults have, or it's a surgical disease that presents any time in life, but it acts a little differently in a child than it may in an adult. And so because we have that special attention and training and practice in managing these types of diseases, that's really the advantage of coming to a pediatric surgeon.
Do all hospitals that treat children have pediatric surgeons?
So there are a variety of types of hospitals. Hospitals that are purely pediatric focused will always have a pediatric surgeon. There are also children's hospitals that are located in a little subset of an adult hospital that often also have pediatric surgeons. But hospitals that are general hospitals that treat all ages of patients without a specific focus in pediatrics may not have a pediatric general surgeon.
And what kind of training do pediatric surgeons receive?
So we, after medical school, do a standard general surgery residency, which would be the same as our adult counterparts do. And then we spend a few additional years focusing specifically on those pediatric surgical diseases from birth all the way through adolescence into adulthood.
Surgery sounds like a broad term, but what are some general pediatric surgeries that you do perform, and what is kind of a normal routine?
Sure. Pediatric surgery is actually very broad, and it's one of the things we kind of pride ourselves in as pediatric surgeons, is being able to treat diseases in almost all spaces and organs of the body. We don't generally operate on hearts, brain, or bone, but almost anything else is fair game. And so that's one of the things I enjoy about my work is the wide variety of things I get to treat, from lesions on the head and face to doing vascular access to doing treating hernias in the abdomen. So any sort of abdominal surgery. We also do lung surgery. The most common surgeries that I do are appendectomies, because appendicitis is very common in kids. Doing endoscopy to remove ingested foreign bodies, and doing hernia surgeries are probably far and away the more common things that we do.
And how many pediatric surgeons are there at ACNW and Arkansas Children's in Little Rock?
So we are a single team. There are 6 of us currently. 5 are located primarily in Little Rock, and I am located primarily in Springdale. However, we both work at both hospitals and take care of patients in all parts of the state.
Excellent. And so let's talk about surgery day. How do you prepare the family, and how do you prepare the child?
Great question. So generally, if it's not an emergency surgery, I have the opportunity to meet the family and the patient in clinic for a preoperative evaluation. That's where we talk about the disease or the surgical diagnosis that brought them to see me. We talk about why that diagnosis has caused a need for surgery, why surgery is beneficial versus potentially not operating, and what the outcome of that may be. Once we talk about the surgery, then we start talking about the day of surgery and what to expect. And so that's really where the conversation starts, about not only the procedure, but what to expect when they come to the hospital, what anesthesia is going to be like. We do provide literature for families, so they have a chance to read up on our parent-present induction that we are able to do, and just start preparing them for what that day of surgery looks like. And it's real important, according to the age of the patient, that we include the patient in their understanding of what's going to happen and give them the opportunity to ask questions as well.
And how has surgery changed in our current situation with COVID and the testing process? What does that look like?
Well, so we do require a COVID pretest for any patient that's going to have an elective operation at either campus. And the way that looks is somewhere from 2 to 4 days before the scheduled day of surgery. We ask the parents to bring the child in to be evaluated for that COVID test, which is a nasal swab. It is available as a drive-through in both hospitals, which tends to make families feel a little better. They don't have to spend a whole lot of time checking in, doing the whole registration process, and coming into the hospital. They can drive up, have the test, and drive off. So we really try to make it as easy and seamless for families as possible. That result then we get back within a day or two, and then are able to have a negative test to make sure it's safe for surgery.
Excellent. Well, Dr. McVay, I have one more question. We have appreciated your time this afternoon. Let's talk about access. If your child does need surgery, you might think it will take months or a really long time to get to see a surgeon at Arkansas Children's or Arkansas Children's Northwest. What is that timeline usually like?
So our goal is to be able to offer a clinic appointment to any outpatient referral within 2 weeks of when we receive that referral. Some families, because of time, choose to wait longer than that, but we really strive to have that 2-week availability. Once we see your child in clinic, our goal again is to have the availability to be in the OR within 2 weeks as well.
That's awesome. I know that it will be good news to parents, knowing that it's a short timeline. And also noting that policies are a little different at Arkansas Children's versus Arkansas Children's Northwest. So just make sure to check with your doctor and your surgeon about their different policies. But Dr. McVay, we appreciate your time. We appreciate you providing right-sized care for our patients at Arkansas Children's Northwest. If you do have a question from Dr. McVay, please leave it below in the comment section, and we'll make sure that she gets to see them. We also want to encourage everyone to get a flu shot. It is flu season, so we want to keep everybody safe, your family safe, your community. So we are letting everyone know now is the time to get a flu shot. So thank you again, Dr. McVay, and we appreciate everybody for watching. We'll see you next time.
Bye.